So just to briefly introduce the panel, and then we'll give them each time to speak a little bit more. Bishop Thomas Bickerton, of course, has been the spokesperson for Imagine No Malaria. And then we have Dr. Christoph Ben, who's with us today from the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And they're an important partner of the Imagine No Malaria initiative. Reverend Gary Henderson from the United Methodist Communications and Imagine No Malaria's director. Dr. Ellison Ige from the General Board of Global Ministries to talk about the wonderful work that's been done through Global Ministries. And then we have Emily Ballard, who is of the Holston Conference of the United Methodist Church, and she has helped to raise more than $60,000 for Imagine No Malaria. So we can't forget the wonderful grassroots support that this program has gotten. I'm going to turn it over to Bishop Bickerton to say just a little more, and then we'll proceed.
Thanks, Diane. You know, this has been a phenomenal and historic day for our United Methodist Church as we've celebrated the Imagine No Malaria campaign at the General Conference. We've raised $68.5 million in our $75 million campaign, and we believe are well on the way to achieving our goal, hopefully by the end of the year. But we continue to celebrate the amazing work of people all across this church who've contributed whatever they could to help make that $68.5 million possible. And this is a real celebration, not of our general church as much as it is a celebration of the grassroots people who have helped to make this campaign more than successful. It's also a tribute to the structure of our church through our Board of Global Ministries to help create the infrastructure that has enabled us to support our hospitals and clinics in Africa in substantial ways to make a difference to people all over that continent. So today, first of all, is a historic and significant day because of the unprecedented amount of funds and organization that it's taken to make the Imagine No Malaria campaign such a success. Secondly, it's a day of significance for our church because of the intentional transition that's happening. We announced during the celebration this morning that Imagine No Malaria will be transferring into a new concept called Abundant Health, where we are committed to addressing the health of 1 million children across the world. And we look forward to how Imagine No Malaria will find further expression through the work of our Board of Global Ministries in the Abundant Health Program. And we celebrate that today and celebrate it significantly as a bit of a segue for us, because while we are still going to be raising money for Imagine No Malaria, and our people are telling us that in significant ways by raising the dollars that they continue to raise. In fact, Ashley told me just a while ago that she's off to train yet another field coordinator for Imagine No Malaria. So while that work will not go away, it is beginning to segue, and we give God thanks for new expressions. Thirdly, I would say that this is a significant day of celebration that acknowledges our partnerships. We, as a faith-based organization, are honored to have a role on the global scene and to unite our efforts with global partners all over the world to make a difference. And as a result of our work in Imagine No Malaria, there are relationships and friendships that have been established that have meant the world to us both personally and professionally. And to my left is a dear friend who has been a great partner in our work in this effort across the world. Dr. Christoph Ben has been a great supporter of our efforts in the United Methodist Church, and through his work in the Global Fund, lives are being touched all over this globe. And we really, truly give thanks for his work and for the great opportunity to be a partner with him in saving people's lives across the globe.
Dr. Ben, if you'd say a few words, please.
Thank you, first of all, Bishop Bickerton, for your very generous words. And I've really come here from Geneva, most of all, to express our deepest appreciation for the work that the United Methodist Church and all its members have been doing over the last couple of years, working with us and others to fight this dreadful disease, malaria. And what progress we've made together. I think that cannot be told loudly and clearly enough. You know, malaria remains one of the most deadliest diseases, particularly for African children. But not so many people know that it has been possible over the last 15 years to reduce mortality from malaria by about 60%. 60%. That's millions of people who are alive today because of that work that the United Methodist Church has joined. And I think, you know, with all humility, I think we all should be very proud that we've been able to be part of that. And among all the kind of churches and faith communities, it has been the United Methodist Church that has been leading the charge here. And the work with you, Bishop Bickerton, with Reverend Henderson, and the whole team, Dr. Ige and Secretary General Thomas Kemper, has been enormously gratifying. And we all know if you want to address a global problem like malaria, nobody can do it on their own. You need a strong partnership. The Global Fund is the main funder of malaria programs worldwide. We are funding about 70% of all malaria interventions internationally. But the United Methodist Church has been our major partner from the faith community, and I'm absolutely certain that in the whole history there has not been a more successful initiative in global health than Imagine No Malaria. And what you've been doing out there in all the congregations and with all your members and the young people and their enthusiasm and their dedication, it's absolutely remarkable and quite unique, and I want to pay tribute to that. And just to give you an idea of what it translates into, through your program, you've been able to contribute $20 million to the Global Fund from the 68.5 million that Bishop Bickerton mentioned. $20 million translates roughly into 10 million treatments for children and 3.6 million bed nets that have been distributed with your support. And that is enormous. If you think of that, 10 million treatments, 3.6 million bed nets, that's affecting the lives of millions of children and families. And you should also know, malaria is not just a disease. It's something that has been affecting communities, families, whole countries and their economies for centuries. And now we can see that we are turning the tide against this disease. In fact, because of the joint efforts, we can now say for the first time in history, we can probably defeat this disease once and for all. There is now actually one of the Sustainable Development Goals that all the leaders of the world subscribed to last year in New York at the UN General Assembly was end malaria as an epidemic by the year 2030. And this is now eminently possible. 20 years ago, nobody would have believed that. Now it is possible. So that's where we are. We don't want to stop there by saying 60% reduction in mortality. We want to go the whole way, and we would love to continue that journey also with you as the United Methodist Church at our side and as a true partner. We've established, I think, a wonderful relationship, and I would like us to continue this journey together in the world. And thank you so much for all that you've been doing for that.
Reverend Henderson.
I think what I'd like to say today is really pay tribute to the many who have participated in the fundraising efforts. It has been really amazing for me to see at the grassroots level of our church so many people involved of every age and every persuasion and every generation. Children hear the simple message that children are dying in Africa mainly because they're poor and don't have access to resources, and they give up their allowance and their lunch money and their savings and their birthdays. Teenagers hear about it. There have been amazing things. We had a group of men ride motorcycles to the Arctic Circle to raise money for Imagine No Malaria. People jumping out of airplanes, something I would not do, but to raise money for Imagine No Malaria. So it really has been this incredible journey. But the other piece that's also been exciting for me is to see the way in which, in the midst of a very large and diverse church, we have been able to come together across agencies, across congregations, across geographic lines. One of the taglines for me at this particular general conference is that we really are better together. If you need evidence of that, look at what we've been able to do through Imagine No Malaria. It was a big dream as we set out on this course. We launched it in 2010. I'm not sure how many believers we had at that point, but it was a big dream. And in the midst of being able to dream a big dream, we come to this day to celebrate $68.5 million. But more than the money, we celebrate the lives that have been changed, the lives that have been impacted, and the generations in the future that will be different because we paused and had opportunity to care. I would conclude simply by saying there is evidence that God is able to do immeasurably more than we can ask or imagine. If you need evidence, think about Imagine No Malaria.
So as we celebrate Imagine No Malaria, we also celebrate the exciting transition into abundant health. And I'll ask Dr. Ige to speak.
My excitement is born from being on the ground and seeing this work. We say to folks that this is the power of a connectional church, where a child in Africa can receive love from all over the world, from people who have never seen them, from people who don't even know their names, who don't even know what the disease is that kills them. I was in Congo a few years ago, and Gary and I were at a clinic that we had Imagine No Malaria had funded to renovate. Congo is a country that's been ridden by wars, clinics broken down, and Imagine No Malaria had funded rehabilitation of that clinic. And we were standing there, and a baby was brought in, this close to dying, gasping. But that child lived because they had medicine, they had diagnostic test kits, and they had resources to get blood transfusion for that child because of Imagine No Malaria. That is the power of the connectional church. You give $1 here and you don't know how much it means to someone millions of, thousands of miles away. It's so exciting to us that, and as a church, in addition to what we have done with Global Fund, we give 51% of the funding that we raise to Global Fund. 49% of that funding is channeled through UMC networks. We support 194 clinics and hospitals in Africa, in 9 countries in Africa. Ordinary people doing extraordinary things. We supported 325,000 nets distribution in Congo, all by volunteers, all by church folks who volunteered their time, went from house to house, helped people put up their nets, and trained them to use these nets. The same thing happened in Sierra Leone, 600,000 nets. Church people giving up time and energy and resources to make a difference in the world. And that is the excitement that we have. And now they have the opportunity to do even more. I say to folks, if you come with a child to the hospital and this child has malaria, and you have medicine for that child, we are excited. But if this child comes and has a fever that is not from malaria, what do? Do you say to the child, oh, I only have medicine for malaria, God bless you? We need a more robust response. And Imagine No Malaria has given us the confidence to do more as a church. We have seen the success of this effort. We have seen we can make a difference. I mean, Christoph is talking millions of people reached. We, from our own side of the work, named 2.3 million nets that we distributed. That's 4.6 million people covered, protected from malaria. Over 250,000 people tested and treated through our UMC clinics and hospitals. What if we do even more and provide abundant health and say, even if you come with diarrhea, we'll respond. If you come with respiratory infections, we'll respond. If your problem is nutritional challenges, we as the church will respond. And we are excited because we know it is possible. We have imagined no malaria. Now we're imagining abundant health. And our promise is to reach 1 million children. And we know we can do it. So help us God.
Thank you, Dr. Ige. Imagine No Malaria really caught the imagination of people across the church, as a couple of our panelists have already alluded to. And so we wanted to hear a representative of all of those people who have engaged their imagination in ways to raise this money. And we asked Emily Ballard to talk about that.
Well, thank you. As it's a really large task to say I'm the spokesperson. Well, I'm just going to give a brief background of myself and Imagine No Malaria. I was my conference council and youth president, my conference council and youth ministries president my senior year in high school. And we sponsor a lot of different events throughout the year, but our largest event takes place in January and ministers to over 14,000 youth over a weekend. Usually we will take up an offering while we're there, and it will go to various things that we have budgeted into our youth service fund. Well, we decided this year that we wanted to take all of the money that we raised and donate it to Imagine No Malaria. When we first took on that task, it was like, okay, this is a great thing. This is going to be wonderful. I don't think any of us there knew what an impact it would make on others around the world, but specifically the impact it would make on us by being spokespeople. So through that, we were able to raise, like you had said, over $60,000 just from the youth and young adult. And that was through that youth event that I was speaking of, through bake sales. We had different people, or different pastors specifically, who would say, if we raise this much money, I will shave my head, or I'll get a pie in the face. We just had all these different creative ways to raise money. And I think it was really the creativity of all of the people in our conference that was able to do this amazing thing. So I am very thankful and very blessed to be a part of this, and also to be sitting next to all of these leaders that have really contributed to Imagine No Malaria in the past. And I pray and I know that we will be able to accomplish more things in the future.